Welcome to this informative video on dementia. So, what is dementia? Dementia is the name for a group of symptoms caused by disorders that affect the brain. It is not specific disease. People with dementia may not be able to think well enough to do normal activities such as getting dressed or eating. They may lose their ability to solve problems or control their emotions. Their personality may change. They may become agitated or see things that are not there.
Facts about dementia. First, 55 million live with dementia worldwide, and Alzheimer's is the most common forms of dementia. And there is no cure for dementia. Women are more likely to get dementia than men, and people with Down syndrome are at risk for dementia. And lastly, dementia is not a normal part of aging.
What are the causes of dementia? Dementia might be due to the advanced age and family history. Furthermore, the most common causes of dementia include degenerative neurological disease and vascular disorders. Degenerative neurological diseases affect many of your body's activities such as balance, movement, talking, breathing, and heart function. Many of these diseases are genetic. Sometimes the cause is a medical condition, such as alcoholism, a tumor, or a stroke. Other causes may include toxins, chemical from metals, and pesticides, and viruses. That includes Alzheimer's disease, depression, Parkinson's disease, Huntington disease, and some types of multiple sclerosis. This disease gets worse over time.
Meanwhile, vascular disorder are conditions that affect the blood circulation and damages blood vessels of the brain, such as traumatic brain injuries or repetitive brain injury caused by car accidents, falls, concussions, etc. Infections of the central nervous system, which includes meningitis, HIV, and Creutzfeldt-Jakob disease. Note that it is a disease affecting nerve cells in the brain, causing mental, physical, and sensory disturbances. Vascular disorder also includes long-time alcohol or drug use. Certain types of hydrocephalus, which is a buildup of fluid in the brain.
Meanwhile, here are some reversible causes of dementia, such as alcohol abuse, brain tumor or cancer, subdural hematomas or blood clots beneath the outer covering of the brain, accumulation of clumps of protein in the brain, normal pressure hydrocephalus, a buildup of fluid in the brain, enlarged structure of the brain, metabolic disorders such as vitamin B12 deficiency, low level of thyroid hormones, which called hypothyroidism, low blood sugar, which called hypoglycemia, and hyperglycemia or diabetes mellitus.
If there are causes for dementia, we also have risk factors. And there are two types of risk factors, which is the first one is non-modifiable and the second one is the modifiable. So, what is dementia? Dementia is not a natural part of aging. It is a set of symptoms that develop when the brain is damaged by disease. And there are many things that can increase a person's chances of developing dementia. Non-modifiable and modifiable are known as risk factors. Non-modifiable are risks that cannot be changed, such as age, genetics, and the gender. For age, this means that as a person gets older, the risk of having dementia rises significantly. For genetics, there are few very rare forms of dementia associated with specific genes. If familial genes are passed down from a parent to a child, they undoubtedly result in dementia. And lastly, for the gender, women who are currently over 80 have a slightly higher risk of getting dementia than men. It is possible that general differences in the lifestyles of these women and men over time have caused differences in their level of risk.
For modifiable risk factor are risks that can be changed through lifestyle choices. So it means nagbabago o nababago. So we have different kinds of example here. The first one is the physical inactivity. We can change this by motivating ourselves to do exercise. For second, smoking. Of course, by help yourself stop smoking. And for the third one, try to share your problems with the others, especially to your family or relative. If you're not comfortable, pray and ask God. Then for the fourth one, the low education. Change your mindset and help yourself to be able to study, especially to be able to read and write. Sad into diabetes, listen to your doctor and be responsible to your diet. For midlife obesity, similar to physical inactivity and diabetes, be responsible to your diet and exercise. Midlife hypertension, avoid eating oily, fatty, and high cholesterol foods. Then, for the last one, hearing loss. So, we have technology. It's the hearing aid to support the hearing problem again. We have low education, diabetes, and midlife obesity. So, for low education, change your mindset and help yourself to be able to study, especially to be able to read and write. For diabetes, listen to your doctor and be responsible to your diet. Always remember that. Then the last one is the midlife obesity. Similar to physical inactivity and diabetes, be responsible to your diet and exercise. So here we have midlife hypertension and hearing loss. So midlife hypertension, avoid eating oily, fatty, and high cholesterol food. Then for hearing loss, we have technology. It is a hearing aid to support and help your hearing problem.
Signs and symptoms of dementia result when once healthy neurons, nerve cells in the brain stop working, lost connection with other brain cells, and die. While everyone loses some neuron as they age, people with dementia experience far greater loss.
The most common warning signs of dementia are memory loss, difficulty performing familiar tasks, problems with language, disorientation to time and place, poor or decreased judgment, problems keeping track of things, misplacing things, changes in mood and behavior, challenges understanding visual and spatial information, and withdrawal from work or social activities.
For our next discussion, we have the diet and food to avoid. This discussion will be discussed with Ms. Javier and Ms. Elisa. This discussion covered the recommendation about what food diet the dementia patient will need and food to avoid. So, yung diet and nutrition, meron siyang isang malaking role para ma-reduce yung dementia ng isang tao. At meron din siyang several risk factor na pwede siyang makapag-develop ng dementia po. Meron kaming mga ibibigay na key directly and lifestyle recommendation para ma-establish natin yung risk factor with focusing research-based information. Tapos po, you can refer the specific literature and reputable health organization up-to-date reference. First is the Mediterranean diet. Ano nga bang Mediterranean diet? Mediterranean diet is consists of plant-based food and healthy fats. Tapos, dito natin kailangan yung lots of vegetable, fruit, beans, nuts, grain, fish. Tapos, dito rin po natin yung pwede natin din i-extra yung virgin olive oil as the source of healthy fat kaysa sa mga meat fats na kailangan natin i-consist po. Tapos po, imo-moderate din natin yung fish, especially rich fish with omega-3 fatty acid. Tapos, pwede natin din yung gawin yung moderate amount of cheese cheese and yogurt. Tapos, pero kailangan din na po nating i-limit yung meat natin. Choosing poultry instead of red meat. Kasi mas masustansya po yung poultry kaysa sa red meat. Tapos po, iwasan din natin or i-lessen natin yung sweet or sugar drinks or butter. Tapos, yung benefits ng dietary diet, it can lower the risk of cardiovascular disease. Tapos, isusupport yung weight gain natin for healthy for you para hindi tayo magkaroon na pumunta sa magkaroon sa dementia po. Tapos, it can also support the healthy sugar, blood pressure, and cholesterol. It can also lowering your risk of metabolic syndrome. Tapos, it can lower a certain types of cancer. Tapos, ito po yung pinaka-highlight para sa Mediterranean. Slowly declining the brain function as you age. Kasi, di ba, kapag tumatanda tayo, yung mismong brain natin is humihina siya ng humihina hanggang nagkakaroon tayo ng iba't ibang sakit na tumatama po sa atin. Katulad ng dementia and Alzheimer po ang pinakamalala. Kaya, pagkain po na Mediterranean diet can also be considered as one of the recommendation para maiwasan po natin dementia natin. Isa rin po ang fatty acid sa pagkain ng ating utak. Kaya kailangan din talaga natin siyang makonsume. Part of the cell membrane to helping to improve our interaction between cells. Tapos po, meron din siyang concentrated in high level cell in your eyes and brain. Kaya kapag kumain ka po or nagko-contain or nagko-consume ka ng omega-3 fatty acid, meron siyang high level na pwede siyang po ang fatty acid sa pagkain ng ating utak. Kaya kailangan din talaga natin siyang makonsume. Next is the antioxidant rich in food. Merong study na sinasuggest ang pagkain ng antioxidant found in fruit, vegetable, and other food may be good for our health on our brain and the other organs. Antioxidant na effective for our brain health. It also help to ward off Alzheimer disease and other form of dementia in older age. Bakit nga ba ang vitamin B is nakaka-help sa dementia patient? It's also possible na ini-increase ng vitamin B level ang improvement or restore your memory and ability to think clearly. Next is limit sugar and refined carbonates. Dito po is consuming too much sugar can also lead to health issue like increased risk of developing dementia. This diet in high sugar can be linked to the reduced cognitive function of memory problem in older adults. Last two is smoking cessation. Ang smoking ay nagpiplay ng significant risk factor for dementia. Quitting in smoking can improve overall health and reduce health risk. Quitting smoking help dementia. Some research state that 40% of dementia cases worldwide ay nagko-contribute ng mga taong nagsisigarilyo. However, a positive note, stopping smoking reduce the risk at pag-a-adapt ng healthier lifestyle choice. Lastly is the limit alcohol. Ang pagko-consume ng alcohol can risk the effect of brain and increase the risk of dementia. Pwede naman nating gamitin or gawin yung moderate or avoiding it altogether.
If there are good foods, of course, there are also bad foods to avoid if your loved one has dementia. First one is fried foods. Hydrogenated oils and foods in high temperatures can cause inflammation to the brain. Advanced glycation end products are often found in the Western diet. Whenever these proteins or lipids come into contact with carbohydrates, they undergo a chemical reaction that causes cells to age faster and stiffen. Second is soda. Consuming soda regularly can cause weight growth and cancer. It may also trigger cognitive abnormalities. Instead of soda, encourage. Third is margarine. Margarine includes chemical additives, trans fat, and an ingredient called diacetyl. Researchers of the University of Minnesota discovered that diacetyl enhances clumping of beta amyloid. It is a protein that is a defining feature of Alzheimer's and may also have a bad effect on the brain. Fourth is processed meat. Processed meats often include nitrosamines, a substance that causes the liver to create lipids that are poisonous to the human brain. Once these toxic fats are created, they can pass the blood-brain barrier, causing damage to the brain cells and insulin resistance in the brain. Cigarettes, as well as some kinds of beer, processed cheese, and refined grains, include these hazardous components. Last is food containing MSG. Monosodium glutamate is a flavor enhancer, which has been found to have a connection to Alzheimer's and has been shown to exacerbate symptoms. MSG overstimulates the neurological system, causing hypersensitivity to external stimuli, such as cigarette smoke and airborne pollutants in Alzheimer's patients. These foods do not have to be eliminated completely in a patient's meal, but rather be consumed in limited quantities or be replaced or combined with a healthier alternative.
The MIND diet or Mediterranean Dash intervention for neurodegenerative delay was developed as a result of research done at Rush University Medical Center with the goal of lowering dementia risk. Also, here are some tips to help someone with dementia to eat more. First, make meal times calm and comfortable. During the middle stages of dementia, distractions, too many choices and changes in perception, taste, and smell can make eating more difficult. The following tips can help. Limit distractions. Serve meals in quiet surroundings, away from the television and other distractions. Keep the table settings simple. Avoid patterned plates, tablecloths, and placemats that might confuse the person. Using color to contrast plates against a tablecloth or placemat can make it easier for the person to distinguish the food from the plate or table. Consider using a plastic tablecloth, napkins, or aprons to make cleanup easier. Provide only the utensils needed for the meal to avoid confusion. Next, distinguish food from the plate. Changes in visual and spatial abilities may make it tough for someone with dementia to distinguish food from the plate or the plate from the table. It can help to use white plates or bowls with a contrasting color placemat. Avoid patterned dishes, tablecloths, and placemats. Next is check the food temperature. A person living with dementia might not be able to tell if something is too hot to eat or drink. Always test the temperature of foods and beverages before serving. Next, offer one food item at a time. The person may be unable to decide among the foods on his or her plate. Serve only one or two items at a time. For example, serve mashed potatoes followed by the main entry. Next, be flexible with food preferences. It is possible the person may suddenly develop certain food preferences or reject foods he or she may have liked in the past.
Next is allow plenty of time to eat. Keep in mind that it can take an hour or more for the person to finish. Next, last but not the least, eat together. Give the person the opportunity to eat with others. Keeping mealtime social can encourage the person to eat. Second tip is encourage independence. During the middle stage of dementia, allow the person with dementia to be as independent as possible during meals. Be ready to help when needed.
Minimize eating and nutrition problems. In the middle and late stages of dementia, swallowing problems can lead to choking and weight loss. Be aware of safety concerns and try these tips. First, Prepare foods so they aren't hard to chew or swallow. Grind foods, cut them into bite-sized pieces, or serve soft foods like applesauce, cottage cheese, and scrambled eggs. Next, be alert for signs of choking. Avoid foods that are difficult to chew too roughly, like raw carrots. Encourage the person to sit up straight with his or head slightly forward. If the person's head tilts backward, move it to a forward position. At the end of the meal, check the person's mouth to make sure food has been swallowed. Learn the Heimlich maneuver in case of an emergency. And the last tip is to address a decreased appetite. If the person has a decreased appetite, try preparing some of his or her favorite foods. You may also consider increasing the person's physical activity or plan for several small meals rather than the usual.